Assalamualaikum. Welcome all to Easy Humanity channel. In this podcast, I discuss short SQ question and answer of frontal bone. Frontal bone forms the region of the forehead. What are the parts of frontal bone? Vertical squamous part, horizontally located orbital plate, which is situated in the inferior part of the squamous part, and it has a nasal part. The squamous part has the external surface, internal surface, and in two side temporal surfaces. External surface is smooth and convex in general, and it has several bony structure present on the external surface. Frontal or metopic suture, frontal tuberosity, superciliary arch, glabella, supraorbital margin, nasal notch. So, what is metopic suture? It is present in 90% cases in the lower part in the median plane, indicate the development of the frontal bone into two different segments which fuse into one. Frontal tuberosity is a round elevation on each side of the median plane 3 cm above the supraorbital margin. It is prominent in young female skull from bony landmark. What do you mean by the superciliary arch? It is a arch eminence and on each side immediately above the supraorbital margin. Supraorbital margin is sharp, but superciliary arch is thicker, and it is separated from frontal tuberosity by a shallow groove. Superciliary arch is formed by the frontal air sinus present within the bones. It is larger in male, in female. What is glabella? It is a smooth elevation in the median part between two superciliary arch. Supraorbital margin. It is formed on the east side and upper convex margin of the orbital opening and separate the vertical part from the horizontal part. Horizontal part is formed by the orbital plate. Supraorbital foramen. Supraorbital foramen is present in the supraorbital margin at the junction of lateral 2/3 and medial 1/3, and it transmits supraorbital nerve and vessels. Nasal part of the frontal bone. There is a nasal notch present. This is the irregular notch and it circulates from medial to lateral nasal bone, frontal process of maxilla and lacrimal bone. What are the features of the internal surface of squamous part of the frontal bone? Sagittal sulcus is a vertical groove. Its margin is attached with the fox cerebri and its groove is lodged superior sagittal sinus. Frontal crest. The margin of the sagittal sulcus unite below to form the crest. Is give attachment of the anterior part of the fox cerebri. Foramen cecum. The frontal crest end below into a notch which is converted into a foramen by the articulation with the ala of the cristagalli of the ethmoid bone. It transmits a vein or vein from nasal mucosa to superior sagittal sinus. Internal surface also present the impression of sulci and gyri, so its look irregular. And there is a tiny groove for the meningeal vessels. temporal surface of the frontal bone is separated from the frontal surface by the superior temporal line. It forms the anterior part of the temporal fossa and present two temporal lines. Superior temporal line give attachment of the temporal fascia and inferior temporal line together with the surface below give origin of the temporalis muscle. Orbital part of frontal bone. There are two thin triangular plates, one on each side of the median plane, form major part of the roof of the orbit. Orbital surface. The inferior surface of the orbital plate is smooth, convex and form major part of the roof of the orbital cavity, and it contains two fossa, lacrimal fossa which is situated anterolaterally, large lacrimal bone, and trochlear fossa lies below and behind the medial end of the supraorbital margin, give attachment to the fibrocartilaginous pulley for the superior oblique muscle. What is ethmoidal notch? It is a wide U-shaped gap situated in between two orbital plates and is articulate with different plate of the ethmoid bone, and through this the olfactory nerve passes. The posterior border of each orbital plate is thin and serrated and articulate with the anterior border of lesser wing of the sphenoid. Now the parietal border of the frontal bone, which is articulate with the anterior border of the parietal bone. What is bregma? It is the meeting point of the two parietal bones and the frontal bone, meeting point of the coronal and sagittal suture. It is the site of the anterior fontanelle. Nasion. This is the meeting point of the two nasal bone with the frontal bone. Frontal air sinus are two irregular cavity, one on each side of the median plane within the frontal bone, opposite the glabella and superciliary arch. Extremely variable in size and roughly triangular in shape, and it communicates with the middle meatus of the corresponding nasal cavity through the frontonasal duct, and it is lined by the pseudostratified serrated columnar epithelium. Development of the frontal bone. Frontal bone is developed from neural crest. The ossification of the frontal bone. Primary ossification center is two, one on each side in the region of the superciliary arch. It appeared 8 weeks of the intrauterine life, and age of union 2nd to 8 years. First union in the upper part, then extend gradually downward. At birth, the two halves are united by frontal or metopic suture. Two secondary ossification center appear at nasal part 8 years of life. Nasal part is developed from it. This is all about podcast of frontal bone. If you find helpful, please share this podcast and please subscribe my channel. Thank you for watching.